We will perform CPR on every patient that is not breathing nor has a pulse, except for trauma cases. The patient's consciousness depends on his pulse, which allows him to breathe. If you arrive to a patient that is unconscious but is breathing, that means he certainly has a pulse. The CPR survey for adults is performed in a couple of stages. We will start with the S stage, safety. Most importantly, your own safety first. Then, get the patient away from any hazard. In addition, ask someone to get a defibrillator. Now, lie down the patient on a hard surface and go on to check their consciousness. Checking the consciousness will be divided into two parts, the verbal test and the physical test. The verbal test will be simple clapping or snapping your fingers while asking the patient if he is alright. The point here is to see if the patient is responding to sound. If the patient does not respond to sound, we will press strongly on both of his trapezius muscles to check response for pain. If the patient does not respond to pain, call an ambulance to get medical help. After checking the patient's consciousness, we'll check the patient's breathing in 3 ways. We will listen, look, and feel. First, place your ear proximate to the patient's mouth to listen if they're breathing. In addition, look at the chest to see if it's rising. And lastly, put your hand on top of the chest to feel movement. These 3 tests together should give you a clear view of the patient's breathing condition. If you see after these 3 tests that the person is not breathing, you need to check if the person has a pulse. If a person has no pulse or is not breathing, it means that the brain is no longer getting any oxygen and that 4 to 6 minutes later, the patient will be brain dead. Therefore, in this scenario, we have limited time and have to start resuscitation immediately. First, we start with chest compressions. We perform the chest compressions to imitate the heart's function and get oxygen-rich blood to flow to the brain and the rest of the organs. The chest compressions will be performed at the center of the chest on the sternum. For men, the sternum is located between the nipples, and for women, it's located at the center of the chest at the level of the 2 armpits. We will perform the chest compressions at a rate of 100 to 120 compressions per minute. The compressions will be performed using your wrists at a 90-degree angle with locked elbows. The time of compression will be equal to the time of relaxation. We will never stop the chest compressions as to not drop the blood pressure we have built. In a case where a defibrillator is available, use it. There are written instructions on every defibrillator. Follow them and use the machine as instructed. First step is to press the green button and turn the machine on. Then, put the stickers on the patient's body as shown in the picture, one on the right chest and one a little to the left and below the left chest, as to surround the heart. Once the stickers are placed on the patient, we must not touch the patient. The machine will then automatically show the patient's heart rate and will then give instructions as of how to continue treatment. If there will be a need, the defibrillator will instruct you to press the button that gives the patient an electrical shock. While this happens, stay away from the patient to avoid getting electrocuted. Once the defibrillator allows it, you must continue with the chest compressions until a medical team arrives. Let's go over the CPR survey again. 1 is the S level, safety. Get the patient away from any hazard while not putting yourself in danger. We will ask someone to get a defibrillator. 2, the A level, airway. We will check the patient's consciousness using verbal and physical tests. 3, if the patient is not conscious, we will call 911 or another emergency service for medical help. 4, we will test the patient's breathing by looking, feeling, and listening. 5, if the patient is not breathing, we will check their pulse. 6, if the patient has no pulse, start chest compressions at a rate of 100 to 120 compressions per minute. 7. Once the defibrillator arrives, we will temporarily stop the chest compressions and follow the defibrillator's instructions. And that's it. Now you know how to perform CPR.